Okay, this video is on trigger finger treatment, uh, requested by Shirley. Okay, I did the video on how to treat carpal tunnel syndrome, but this is different, although it involves the hand. So when you say trigger finger, you're referring to this pop motion that is caused by flexing the finger and you're trying to extend it. Not so much flexing. When you flex, it locks, but then you go to extend it, it pops. All right, and it's not the joint that's involved. Joints are not involved in this condition. Okay, so when you say trigger finger, you're involving the flexor tendons. This motion is called flexion. That's called extension. So the flexors are located here. See that? Those muscles actually bend the wrist and they bend the fingers. So, what is trigger finger? Well, and from an anatomy standpoint, it doesn't really involve the nerves. All right, it's not a sensation issue, although it can involve pain. Trigger finger involves specifically the A1 pulley in the palm, so we can't see this. Now you have tendons there. That's a tendon. Those are tendons, right? Related. Anyway, the tendons pass through. If you can actually take all this, and you can see they actually spray out like this, like rays of the sun, and they pass through pulleys. So if you will imagine a fishing rod and the fishing line is going through the little eyes, that's what it looks like. Okay, and they're contained in those pulleys so that when we do this, the tendons will slide around, and you have that on your foot as well, and you actually have it up here as well. Okay, but more commonly it affects this. And how does that happen? So your hand is actually designed um, to function as a whole, your fingers. This is called fine motor manipulation. So buttoning, writing, um, but this typically is involved with any kind of lifting. So imagine if you were pulling on a rope or you were climbing a rope, and you didn't use all four fingers. You pulled a little too hard with one finger. You would actually strain that tendon. Okay, so what is a strain? A strain by definition is a tear in the tendon, whether it's 3%, 5%, or 55%, or 85. It's a tear. All right, we just use the medical term strain to designate that injury, but in layman's term, it's actually a tear. So you've torn the tendon. So what happens to a tendon when you tear it? What happens to tissue when you tear it? It swells up. So in this case, the tendon swells up. So imagine this tendon starting to get big like this, and now it's occupying that small pulley. Now the tendon, as we know, has to slide in and out when we do this. So every time we do this, the tendon goes out, you go this, the tendon goes in. And if you have this bulb now that's formed in there, this thing swells up, but not with air, it's fluid. And now it has to pass through that tiny pulley, and it does this. All right, in more severe cases, it passes through and it doesn't come back out. All right, so that's like this, and then the person has to pull, and it goes pop, and now it's free again until they do this again. So you can imagine what a pain in the ass it's going to be if you can't just open your hand at will, and it affects the way you use your hand. So it can be a little disconcerting. I would certainly probably be panicking if I can't open my hand, and the problem is the more you do this, the more you irritate it. So I've heard from my own patients that a common treatment that they want to do is that they've been doing or they've been recommended to do is to squeeze a tennis ball. That's probably the worst thing you can do for it. Imagine if you sprained your ankle, the last thing you want to do is walk on it, right? So you rest it, you ice it, you take your non-steroidal anti-inflammatory, so your acetaminophen, your ibuprofen. So if you go to the doctor, they'll give you a shot. In more severe cases, and it's chronic, the doctor actually does a cut, like a Z incision. He opens it up and he cuts the pulley. So now the pulley's cut, and now the tendon is free to move back and forth. Don't worry, it's still contained in there by the tissue. So and then you have to go through therapy so your hand doesn't freeze up. But conservatively, we use ice. You can take an ice cube and you rub it, not an ice pack, ice cube. Get it there 5 minutes, okay, until it goes numb. You massage it. When we massage it, the hand starts from here. You see that right there? I have to push that. So if I do this with my, let's use the index finger. See that? The index finger has its own set of muscles. So does your little finger. It's called your flexor digiti minimi muscle. I digress. My point here is stretch the muscles that actually pull it down. And while you're at it, stretch the whole thing, right? We already talked about this and how to loosen it up. When you get to the hand proper, you actually do a friction massage to free the tight connective tissue, because if you have it in more subacute chronic cases, you actually form scarring in there. All right, because the tissue is not stretched on a regular basis. So you have to break down those adhesions. And once you've done that and you're pretty satisfied with it, then you actually stretch. So this is flexion, that is extension. So you stretch it that way, and while you're at it, stretch it this way. Also stretch that way, that way. For carpal tunnel, we actually do this. All right, what does that do? It opens this up, and that takes the pressure off here. So do you actually need to strengthen? No. You try to avoid strengthening. You try to actually modify the way you use your hand. In the meantime, no heavy squeezing, and just don't use it heavy. Use it or lose it, right? Motion is lotion. If you move frequently, you will tend to stay loose. And try not to irritate it over and over and over, because that's when something minor becomes problematic, and now you need to have surgery. All right, so hopefully that helps. Very, very simple, except it's easy.